So when I was applying for a residency, I ended up finding Monument Health in that search, and there was just a lot of things that really appealed to me about this place. Things like being an unopposed residency, the amount of support that you have in clinic, and just in general, the amount of learning that was available here in this area.
Major reason that I chose to come here is that I had a large interest in rural full spectrum family medicine. And I felt like this was kind of a gem just because of what we get trained to do here. So we really get a very broad spectrum of being able to take care of people in the hospital setting, the emergency department, or the outpatient setting. And along with that, I felt like that was good in this program, but the opportunity to actually go and practice somewhere in the hills and actually be able to do full spectrum medicine, where I was researching the programs I was interested in, didn't really find anywhere else that provided the opportunity to train you to do full spectrum and then give you job opportunities in the local area to be able to do that as well.
I think another thing was the fact that they did have an OB program, which was appealing to me. I know that a lot of programs struggle with that, and so the fact that there were opportunities to work hard and learn how to do OB, I was pretty excited about that too. I think just allow yourself to be excited about starting residency because it is a challenging time and you're going to be exhausted some of the time, but you get to finally learn and practice all the things that you've been reading so long to do, and it's just a lot of fun.
So as chief resident this year, we work really closely with the program director and all the faculty members to make sure that we're improving the life for the residents and figuring out what works and what doesn't work. We get to talk with faculty and kind of try to help improve our program. One of the goals that we have this year as chief resident that we're working towards is working on clinic flow and clinic efficiency, especially as we gain into that second and third year of residency when we start seeing more patients.
I would say I didn't really know what to expect in terms of attending docs, and I would say both in terms of our individual residency attending doctors as well as our community attendings, and by that I mean, say, the neurologist who we work with for a month or the cardiologist. Really across the board, I've had very, very positive experiences. I think part of residency is learning how to tread water first, especially when you're thrown into a whole bunch of new stuff. But eventually you start to get the hang of it and start to do better and better, and it stops being so much of a burden and much more of an opportunity to learn. And so you're doing it. You're really in it. You're doing the real doctor stuff that you've probably been fantasizing about this entire time. And so that transition that you had as a medical student, going from academic stuff, learning classes, to clinical things in your third and fourth year, it's very similar to that, but probably an even bigger step going from finishing up fourth year to being a resident. You're a real doctor, tons of support from your fellow residents. I will say the community here at our residency is excellent. I think that the residents really make a point of watching out for each other, of making sure that all of the questions that you have get answered, but also that you're just feeling okay.